Hi there, I'm Bob Weir with another interview of interest to residents of Denton County. My guests today are Denton County Commissioner Bobby Mitchell and Denton County Judge Andy Eads. Thank you both for being here. If you would, let's begin by tell us something about the need for mental health navigators in Denton County.
Okay.
Well, Bob, back in 2016, Gary Henderson with United Way and Joe Mulroy came to me and we had a luncheon. We found out that at that time, the Denton County Jail was a hospital for mental health people. If they got stopped for something, they took them to the jail and they had no idea that they had mental health issues, and so they had to sort that out. So we put together a Denton County Behavioral Health Leadership Team with several people from the county, from the cities, from the school district, from social services, just the ordinary citizen, to veteran services, to discuss the issues that we had with the MHMO needs here in Denton County. We also had the MHMO director there. So that's how we got started, when we started talking about what can we do. And we spent all this time finding solutions and help. But you know, the thing that really broke my heart, Bob, is when Lisa Elliott with Cook Children's Hospital came to us. She's on our committee, and she said to us, there was a 5-year-old child that, and this was after the pandemic. See, you know, we were doing bad before pandemic, but after pandemic, you know, the lid was uncovered because people didn't have anywhere to go or didn't know what to do. So she said to us that this 5-year-old child ran out in the streets because he wanted to kill himself. Now, I can understand, I don't like it, but I can see maybe an adult, but a 5-year-old child. And so here in Denton County, we got to work. We had judges and we have everybody on our committee and said, what can we do? The emergency room has become a hospital for mental health, you know, and you know,
jail.
And the jail. And so you know, we found out that we had to do more.
Well, you saw there was certainly a need.
Yes, we had to do more.
So, and to that end, recently the Commissioner's Court approved the hiring of 2 mental health navigators. Could you please explain the job description?
So the commissioner did a good job of explaining the fact that there's a need out there for help. And one thing is we're short, Bob, in healthcare providers. Mm-hmm. So we need, so if there's any mental health care providers out there that want to watch this or come to Denton County, we would love to have you because you have a built-in clientele. So there's obviously a need, but it's the matchmaking. So when someone has a need, their child is in distress, as Bobby mentioned, or one of their loved ones or a coworker, how do people connect to the right care provider for them? Okay, and so one of the things that we realized, because there's a shortage of providers, they might get a list of 20 providers and they're calling every one of them and they're full. They don't have any room in their clientele, any room in their practice. Just like some providers they're full in their practices, and so they're not accepting any new patients. And so that's, especially if you're in a crisis situation, this is not the time to be rejected continually. So by the county taking the lead on this, and the commissioner's done a great job working on a behavioral health leadership team with Gary and others.
As a court's liaison.
As a court's liaison. But the United Way is not a service provider. Okay, they're not a service provider. So how do we provide that linkage between the people calling and needing assistance and the provider? And so these navigators are going to do just what it says. They're going to navigate for when someone has a central calling center. They can call the county, explain their situation, get some basic information, and then connect them so that they're not rejected by different providers, and that they're actually followed up on and say, hey, did you make that connection? We referred you to that provider. And did it work well, or do we need to find you somewhere else?
They are the guides that will, as you say, navigate someone who takes away the obstacles that they might run into when they need it.
Kind of a one-stop shop. They can call us and we'll help place them, and so that they're not calling different. If we had an abundance of providers, it'd be a little bit different. You could call and get in. But this is when someone's in a distress situation or in need. This is no time to be called.
But these are non-emergency mental health
These are
concerns.
non-emergency.
Right,
They would,
non-emergency.
they would still call MHMR, the crisis line, for MHMR,
Okay, so-
if they're in a crisis.
So there would be a difference between emergency situations, okay?
Absolutely.
And those are already being
And
addressed.
so,
Yes.
so we are all about best practices. So part of the committee that the commissioner served on has been all these last few years, since 16, they've been working on identifying best practices, and this Navigator is definitely a best practice. And one of those best practices is if someone was in an emergency situation and they actually called ours, which is going to be staffed during business hours,
Yes.
okay, it's a non-emergency. But if they did call us, we would connect them to the emergency provider and stay on the line with them and make sure that connection happens, so that we're not hanging up. Instead of giving, in an emergency situation, you don't need to hang up on them and give them another phone number to call.
Would a homeless person be a non-emergency, or do you provide?
It depends on the, the situation that they're in. That could be a non-emergency, or if they're in stress, it could be,
Emergency.
yeah.
So, and those struggling with drug addiction?
Yes.
They might also avail themselves of
Right.
this?
Absolutely.
There was a mention of the American Rescue Plan, that it's expired or something, what was that?
So what we will be using the American Rescue Plan, those are some of the funds that were allocated by the federal government to local entities, and Denton County's qualified. We've had a lot of resources, and what's great, we've been able to use these funds over the last few years to set up some great infrastructure here at the county, a lot with
Yes.
our food banks, and the commissioners worked on the food banks across the county, but this mental health is obviously one of the byproducts of the COVID that we've been dealing with for the last few years.
Okay, so the mental health navigator, will they be experienced in counseling and other forms of social work?
Do you want to do that one?
Yes, they would be experienced in counseling, have license also, so they can come in and the good thing about being at the health department, that they'll have all the resources.
Yeah.
Because we discussed putting them at MHMR and, standalone. But the good thing about the health department, they'll have the resources that, with our health department and the directors there, that can help them and make sure that they stay on the right track.
And
So these are
they-
good paying jobs. They're about $50,000, the starting wage is about $50,000, and they'll be a part of our Denton County
And they work
family.
under the aegis of the Denton Health
Yes.
Yes,
Department.
and the ideal candidate is someone who has a licensed social worker and understands the social work system and the network, and has that obviously that care and compassion, and that's kind of ideal candidate we're going to be looking
So
for.
they might possibly hold a degree in the field?
Yes.
Yes,
Of that, and hold a
absolutely.
license and stuff like that?
Yes.
Okay. Will they be working full-time?
These are full-time positions,
And at what salary?
so they're about $50,000, and so
Plus, yeah.
So we're looking at, if you want to apply, you can go to dentoncounty.gov, and the positions are active right now.
All right, that took care of my next question.
Okay,
That's
good.
good. All right, so, and if they do apply and you get the right people, when would they start?
They would-
Approximately?
Usually it's about a 2-week hiring process at the county. Once you go through the background check and the interviews and so forth, they extend an offer that we onboard, and the commissioners court votes on all the new hires, and so it's a couple of weeks start. But I'm really appreciative, Bob, that you and Annette opened your home and invited the commissioner and I to come visit about this, because this is an important thing.
Yes.
Mental health is important to all of us.
Oh, I agree,
And-
I agree. We talk about this all the time. We see what's happening throughout, actually the whole country.
Yes,
Going
it
through a
is.
terrible
It's just- yeah.
homeless situation, people on drugs and mental health situations. So when I heard about this, and Annette told me about it first, she saw it and she said, did you know that they were doing that? I said, really? Well, it looks to me like that's something we need. They're right on top of it all the time. So I congratulate you
If someone,
guys.
we were talking about this, and the commissioner made a very impassioned appeal about this in court the day we voted on this, but if someone was to come in and be on crutches physically, you would, or limping, or just wasn't feeling right, you would go over and render aid. That's, you'd open the door for them, say, come in, it's here, take my seat. You would do that. But mental health is invisible so many
That's
times,
right,
and so
yeah.
people are we're all going through something,
And
aren't we? And so,
tragically, we don't know about it until there is a tragedy.
Right.
right, it's every day in the news.
And
Yeah,
one
it's
of the
every day in
things
the
that
news.
we were stressing, that it's okay to say mental health.
Sure.
Because,
yeah.
it used to be,
Yeah.
nobody wanted to talk about mental health.
People would be afraid of it. It had a
Yes,
stigma
it had a
attached to it.
stigma
or something,
attached.
yeah.
But now it's okay, because it's
Yeah.
all over the country, it's not just in one family, you know, it's everywhere, so,
And that's why we're talking about it.
yes.
Yeah, we have to let people know that it's okay to ask for
Yeah.
that kind of help.
Yeah.
All right, we're being grabbed by the clock, so, is there anything else you'd like to add before we close?
Again, thank you for doing
Yes.
this, and we're very excited about onboarding these new individuals, and I think it'd be great, Bob, if, once we get them on board, they come visit with you. And
Oh, I
talk
love
about the
that.
great things.
Yes.
I love
And
it.
one thing that's important, I've got to say this, I know we're running out of time in that, is that one of the reasons that the Commissioners Court wanted to have it at the county, this program, was that it's gonna be very measurable, and that we're gonna be able to track the phone calls, track the type of calls,
That's
where they're
great.
coming from, and so that it'll give us a data set, so if we say, hey, we need to add more people, or
Yeah.
less people, or seek other partners, I think it'd be a great data set for us to really monitor. And transparency.
Yeah, all right, well, again, I want to thank you guys for being here and for your attention to this really important community need.
Yeah,
Thank you very much.
Thank you,
Thank you.
guys.
thank you, Bob, for always
Thank you.
being on top in the community.
that's right.
And thank you guys for the great job that you do in the community.
All right.
And thank you for watching.
Thank you,
Thank
Annette.